So, melatonin is one of the most common over the counter supplements used for the treatment of insomnia. And to be honest, the evidence for use of melatonin in chronic insomnia is pretty mild and limited. And the American Academy of Sleep Medicine actually doesn't recommend its use as a standalone treatment for chronic insomnia, and certainly, of course, recommends the use of cognitive behavioral therapy. But what is melatonin used for, and how can we still use it in the context of treating sleep problems? So in this video, I'm going to talk about how we can use and administer melatonin in the context of treating certain specific sleep problems, such as those of the circadian rhythm challenges. Hi, if you're new here, my name is Dr. Parky. I'm a clinical psychologist and a behavioral sleep medicine specialist. I did my postdoctoral fellowship at Stanford Sleep Health and Insomnia program, and I'm also author of the book, The Insomnia Paradox, which provides evidence-based cognitive behavioral therapy strategies in the treatment of chronic insomnia. So fundamentally, melatonin is not a hypnotic. It doesn't necessarily make a person immediately fall asleep, but what it is a chronobiotic, meaning it affects our internal circadian rhythm by allowing for the production of melatonin a little bit either earlier or a little bit later in our cycle. And melatonin is kind of the sort of endogenous melatonin is the thing that sort of allows us to kind of recognize our body to recognize that we are supposed to start feeling a little bit more sleepy. And usually melatonin starts to become produced about 2 hours before bedtime. So the fact that melatonin production happens about 2 hours before bedtime kind of suggests something very interesting. It suggests that people who take it, 15 minutes, 20 minutes, 30 minutes before bed probably didn't have a very significant impact of that melatonin on their actual sleep, because the melatonin was produced at, let's say, 10, and they're taking it at 11:30 and then trying to sleep at 12, that extra melatonin may not actually do very much in the context of a sort of actual physiological effect alongside, of course, maybe it has a psychological effect of reducing anxiety and setting the expectation in our mind that, oh, I've taken my melatonin, I'm ready for bed. But from a physiological perspective, it may not actually have very much impact on our overall sleep systems. But what melatonin can be really helpful for then is that by properly timing exogenous melatonin, we can actually therefore impact our body's internal clock. Depending on when we take the melatonin, it can ask our internal clock or circadian rhythm to, become a little bit more like an early bird, or shift it and delay it and make us feel like a little bit more of a night owl. And I won't get into the nitty-gritties of the science, but essentially there's something called the phase response curve, where you place light and where you place melatonin can actually impact our circadian rhythm and change when our melatonin endogenously inside of us is produced. So typically, most people who come into insomnia or sleep-related therapies, they are someone who are delayed in terms of their circadian rhythm, otherwise known as chronotype. So they're going to bed like at 3 a.m. and waking up at 11, and obviously that doesn't coincide very well with school or work. So that's going to cause a lot of friction. It's going to cause problems for them. So what we do in terms of melatonin timing is to actually administer melatonin, and this is usually about zero point 0.3 to zero point 0.5 milligrams, about 5 hours before their bedtime. So let's say they're going to bed right now at 3 a.m. So we're going back 5 hours or thereabouts, they're going to be taking that melatonin about 10 p.m. And as their sort of window shifts, then they're going to bed at 2 and then 1, we can kind of adjust the melatonin timing to make sure that they're getting to the point where they want to be when it comes to their actual bedtime. Now, let's say you're not a super night owl, you're actually an early bird. You have a very advanced circadian phase and you're going to bed and waking up like super early, and you're like, I don't really want to do that because I'm waking up at 4 a.m. and nobody else is up. It's like super isolating at that time. And like, at 8 p.m., all my friends are out and they're partying, and I'm experiencing like severe FOMO because I could be doing all that, but I'm like so sleepy at that time. In that context, you actually want to time your melatonin in the morning. So typically after you wake up, that's when you take your low dose melatonin, zero point 0.3 to zero point 0.5 milligrams. And then that's actually going to be really helpful to make sure that your circadian rhythm, the melatonin, is actually starting to delay itself. And then over time, you're going to notice yourself shifting from an early bird into a bit more of like a regular lark, or, whatever is kind of in the middle, intermediate circadian rhythm. And if you're looking for the biggest effect of melatonin on your overall circadian rhythm, you can also include sort of light therapy alongside the melatonin. So again, if you're trying to advance your circadian rhythm, become a bit more of an early bird, then you want more kind of evening melatonin about 5 hours before your bedtime and getting some sunlight in the morning. On the other hand, if you're trying to become a bit more of a night owl, maybe you're going to bed too early, waking up too early, in this context, you want the melatonin in the morning, but the light in the evening because you want the circadian rhythm to say, whoa, like it's so bright and it's already 6, 7 p.m. Maybe I should be like waking up a little bit more. So in this context, you would want morning melatonin with evening light. So melatonin isn't exactly the best medication when it comes to treatment of insomnia, but it can be a pretty darn good chronobiotic and can really help some people set their circadian rhythm in a way that fits better with society's needs as well as your own values. So hopefully this video was helpful to learn a little bit more about the context of how melatonin is administered from a behavioral sleep medicine perspective. Otherwise, I hope you have a wonderful rest of your day. Take good care for now. Bye-bye.